Hi, I'm Dr. Stanley Levenson of Worcester, Massachusetts. Do you wake up in the morning not refreshed from your night's sleep? Do you tend to doze in front of the television or even at a traffic light? You may have a serious medical condition called obstructive sleep apnea. I'm a dentist who is trained to help people like you. About 10% of the adult population in the U.S. suffers from this disorder. Almost everybody that has this disorder snores. Many people tend to be overweight and have other medical conditions that may indicate they have this problem. Sleep apnea has been associated with other medical conditions such as stroke, high blood pressure, depression, and erectile dysfunction. As a dentist, we're here to help recognize the problem and potentially recommend treatment for you for this serious condition. If you feel that you may be someone that has obstructive sleep apnea or OSA, it's important to get a sleep study. A sleep study measures the oxygen in your blood, and if you stop breathing, the sleep study can only be prescribed by a physician. The study can be done at a sleep center or at home. If you are diagnosed with OSA, your physician will most likely recommend a device called a CPAP. CPAP stands for continuous positive air pressure. The CPAP is basically a mask that puts air down your throat with pressure opening up your airway and allowing you to get the oxygen you need to have a safe, peaceful night's sleep. Unfortunately, the majority of people hate it. They can't wear it. They'll try it for a week or two. I've had patients that can't even tolerate it for a night. The good news is, a dental profession, we have the ability to create what we call an oral sleep appliance. This appliance basically pushes your lower jaw forward, allowing space so your tongue can come forward, thereby opening up your airway as you breathe through your nose. So if, in fact, your teeth are normally in this position, the oral appliance will push you forward and open you up, clearing space for your airway for the exchange of oxygen through the course of the night. This appliance is an example of one of several appliances that are FDA approved for the treatment of mild to moderate sleep apnea. What that means is, if you can't wear CPAP and you want another solution, this will work. In addition, the people that are using these appliances have a far greater compliance. The average person that gets this appliance wears it. And the whole purpose of treatment is to be successful. So we know we're successful because after you're fitted for the appliance, we would recommend a follow-up study to know if in fact it's working. If what you've heard so far makes sense and you feel you or a loved one may have obstructive sleep apnea, please call our office for a no-obligation consultation. If you've already had a sleep study, or you already have a CPAP and hate it, or if you haven't had a study, we can help arrange one. We will also be glad to help you prior authorize your medical claim to allow the insurance to pay for this device. So, I hope you've learned something today. I'm Dr. Stanley Levenson. Sleep well tonight.